I'm Sue and Leyland. I'm a local business owner here in Emerald. I've lived here for the last 3 years with my husband. We came up here and purchased a couple of local restaurants after his so-called retirement.
She's a jovial person. She loves life. She's always looking for the next adventure. We try to get on the road with the caravan as much as possible, which is, with our involvement with the business, is a little bit hard at times, but we just enjoy the adventures, different places, different things that are out there. We revel in it.
Well, it was Christmas Day. We had a very, very busy day at the restaurant. At 4 o'clock the following morning on Boxing Day, I woke up with immense pain in my chest. Could barely move, could barely breathe. Dave was incredibly stressed and he just said, "That's it, I'm taking you off to the hospital."
I felt scared for the situation, scared for Sue. I've never experienced anything like that in my life before.
A lot of our job in an emergency setting, acutely, is trying to figure out what's wrong with the patient. That can be a challenge, and as much information as we can possibly have quickly available at our fingertips is really, really helpful when we're making that assessment and doing that investigation. Having some digital record, especially from the general practice setting, that allows us to look at some of the patient's usual medicines, usual sort of medical problems, certainly can make our job investigating a lot easier. Sue's situation was in fact a heart attack, and after initial stabilisation and management, our management plan was to transfer her to a cardiac hospital in Brisbane.
By lunchtime, I was out at Emerald Airport being loaded onto the Royal Flying Doctor's plane, and I was flown straight to Brisbane.
I was blown away by the speed that it had all happened, and we were in constant communication while she was down there. All the test results came back and very positive. You know, I was greatly relieved, and when we did meet up again at Emerald, it was just a lovely feeling to know that I had her back.
You hear stories about country towns that, somebody gets sick in the middle of the night, they've got to call in a doctor. Well, I didn't have that experience. Everything that I needed was there. I didn't need anything else. Nothing seemed to be a problem.
With my health record, the continuity of care for Susan was really good. There was no sort of handover period like giving history of what I'd been going through. My health record just followed her on the path.
Having my medical records in one place means I don't have to carry them with us in the caravan or wherever we plan to be in the future. It gives me confidence to know that I'll get looked after.
Doesn't matter where in Australia we end up. If there's any issues, my health records are there.
Having my records in one place gives me peace of mind and, more importantly, freedom.